So we get fat, we get blood, we add in your bone graft, we mix them all together, and then we inject into the nose, and voila! You got your Lipomatrix 2.0. Hello, this is Dr. Claudine Roura, the Fat Sucker, and welcome to my channel. Today is procedure day, kaya nga tayo naka-scrub. We'll be discussing today about Lipomatrix Rhinoplasty. Okay. From the name itself, it's lipo, which is fat, and matrix, which is a combination of your fibrin matrix from the blood and bone matrix from bone. I'm very heavy on fat graftings for the face, for the body, okay? And then I was always wondering, always put fat on the cheeks, on the nasolabials, forehead, under eyes, everywhere else, okay? But however, nobody does actually fat grafting for the nose. Okay, I really wondered why. So I really tried it. I tried it like more than a year ago. I've been working on this almost 2 years. And then the initial one is when we do the lipo for that one, for the fat grafting for that one, it's just pure liquefied fat. Okay. However, when we inject it, it gives a little volume, but it doesn't stay long and it doesn't give too much form. I'll need to find a way on how to actually make it form. I researched and I tried that out, and I found that one autologous factor will be actually your blood. Your blood, okay, part of your blood is actually what we call the fibrin component of the blood. The fibrin is the one that actually binds the blood together. Okay, so it's basically your scab is actually blood, platelets, and other cells trapped in a fibrin matrix. Okay, that is for the wound healing part. So when I did that, it actually started to be called lipogel because the fat became gel-like. No, it's more solid. It's been gelled and it can be injected through a cannula, and it's non-surgical. I was doing the Lipomatrix 1.0. I call it the 1.0, which was original. You augment the bridge, the tip, and the columella with the injections. However, it's kind of short-lived. So I laid low on that for a while, and then I almost gave up actually. I was really trying to think of a way how to prolong the longevity of the graft. So what can I add that is natural, autologous, injectable that would make it last longer? I thought of a bone graft. Bone graft. Like maybe it can become an injectable bone graft. However, if you get bone, it's going to be like a major surgery. If you get cartilage, also surgery. It's still another cutting. But I really wanted to be primarily non-cutting, non-surgical. Fortunately, my family, okay, my husband is an orthopedic surgeon. My family are all dentists. So they both use bone grafts. No, I was thinking like, since the nose is partly bone and partly cartilage, why don't we put like bone graft? But this one I want to be injectable, so I was looking for a powderized form or a granule form. The orthopedic surgeons put bone grafts in fractures whenever they need extra bone material so that the bone will actually fuse. And the dentists also use bone grafts for implant dentistry. Okay, for example, you actually need bone to fill in a socket or to fill in a tooth. So for the face, I focus more on the dental kind of bone graft, and they come actually in granules. And this is actually a sample of it. So I started tinkering around with it. And then with the fat, I put the fibrin matrix. With the blood, and I put the bone graft. And then I inject. Okay, so we get fat, we get blood, we add in your bone graft, we mix them all together, and then we inject into the nose, and voila! You got your Lipomatrix 2.0. Okay? So we also did some x-rays, radiographic x-rays of the bone graft in the nose, and it's fairly staying well. Normally, we just put in around 0.5 cc of the bone graft. Okay, if you compare it to an implant like a Gore-Tex or silicone, okay, the entire volume of a Gore-Tex or a silicone implant is actually 1 to 2 c, 1 to 2 ml, 1 to 2 cc, depending on, of course, how big and how much volume augmentation that you need. Now, once injected, actually, definitely we put a little bit of local anesthesia, of course, to numb the area. And then once we inject, okay, our actually objective here is to stimulate new bone formation, okay? Because we actually put it directly, we scrape actually the bridge of the nose to put it very near the periosteal plane so that we can actually, theoretically, stimulate new bone formation for that one to augment the bridge. Okay? Now, so the fat graft actually becomes either one, a calcified fat graft, okay, or if the fat grafts actually dissolve away, then the bone graft will stay. So ensuring the permanence of your graft, your rhinoplasty. So actually, this is the first of it in the, not only in the Philippines, but all over the world, because I'm actually the primary developer of the technique. Okay, so the fat comes from you, the blood comes from you, and the bone graft actually is calcium hydroxyapatite. Okay, this actually is the same exact component as your actual bone. Okay, so your body doesn't see it as a foreign material. Hence, there is no rejection. And also, it's a soft graft. Okay, so it's a soft augmentation. It's not hard augmentation like the silicone that when you get there's trauma, okay, the implant can actually extrude. Since we only put in 0.5 cc of the graft, of the bone graft, we actually wait around 3 months. Okay, for the first week, you actually see swelling. Immediately after, of course, when you inject local anesthesia, when you inject the Lipomatrix graft, okay, there is a lot of fluid that's in it. So we actually overcorrect it a bit. So your nose will look a little bit big and swollen immediately after. And then the fluids actually get absorbed. You will have a little bit swelling because there's not much trauma for it. Okay, and then actually you will see the best result of this one is actually on the 3rd month. Okay, on the 3rd month. And after 3 months, this is the time you actually decide if you want to do another injection of the Lipomatrix to top up the first. Okay, remember, we only put in 0.5 cc of the bone graft. If we want higher, we can actually add in more bone graft to augment further the bridge, the tip, and the columella. There's no cutting, no scars, no rejection, no extrusion, virtually painless, okay? Minimal to zero downtime, non-surgical, and it's permanent, okay? You can actually see it radiographically. Hello, hi, I'm actually here in our CBCT scan room. These are our patients that we did Lipomatrix Rhinoplasty. Okay? So I will just want to show you how permanent the bone matrix is, or the Lipomatrix is, for our rhinoplasty. For this anatomy here, this is the nasal bone. This white spot here up to the columella. From the bridge to the tip to the columella, this is actually your bone graft. Okay? If you see the 3-dimensional version of this is the soft tissue. And then when we remove it, see this part here? This is actually your bone graft, okay? So when we remove the contrast from the soft tissue to the bony matrix to the bone tissue. So this is basically your bone matrix. This is basically your bone matrix. So it adds in, for its permanence, the bone matrix for the rhinoplasty. Okay, so we can augment the bridge, we can improve on the tip, and we can also improve on the columella. Basically, you get fat, you get blood, you put in your bone graft, you mix them together, and then you inject. You just want it as simple as that. Well, there you have it. The Lipomatrix Injectable Bone Graft for Rhinoplasty. I will see you again next time for another vlog on our procedures. And again, this is the Fat Sucker, Dr. Claudine Roura, saying, see you in our next episode. Please like and subscribe. Okay, and for more videos, please hit that button down there. Bye-bye!